Well, it has been a while, but it is once again another time for Show Up Central Oregon. Hello, all. Matt Hand. I am extremely excited to be joined today by John Jepson. John is a member of St. Charles Foundation, and we are going to be discussing how we as community members can be better supporting those critical frontline care workers. So, John, it is my pleasure to have you today. How are you, sir?
I'm great, Matt. Thanks. It's nice to come to you from my kitchen area.
Yeah, we're talking about all the changes that we make as far as as to sequester ourselves and make things a better studio environment and all those things before we were on the air. So I definitely appreciate you taking the time today. Your life obviously has been pretty hectic over the last few weeks, and I especially thank you and thank all of those frontline care workers that are out there. I would like to talk, though, a little bit about how we, as the general citizen, can go about, as hopefully we have done a good job of flattening the curve, but I know that those frontline workers still need support. And how can we go about supporting them today? So, could you give us some ideas on some things that would be great for us to think about?
Absolutely. The one of the most important things has been to flatten the curve, as you were talking about, and then to be able to have a pretty controlled environment at the hospitals that allows us not to get overrun. And so the first thing that we really asked the community to do individually was the social distancing, which has been critically important. And then we've seen, and we continue to see, the community really come forward in a couple areas. In-kind support, meaning things that they can give or make. We had a 10,000 mask challenge, which was met by the community in making 10,000 masks because we had a real critical potential shortage of supplies. And then as well, financially is an area that we've gone to the community, but they've gone beyond that. I mean, the community has really said, well, what can we do in terms of being creative with, bringing food to caregivers or making masks or face shields, or even businesses who have made hand sanitizer. So it's really been the community all coming around us, which our caregivers have definitely felt and continue to feel.
Yeah, I know there was also some people delivering food and a lot of other great things that have transpired, and obviously the community really did sort of show up for the care workers. And I kind of am curious, now that things are, I know that we're not out of the woods yet. I mean, the
Right.
reality is we still have some time. And I know that there's some things going on. St. Charles is going to be opening back up some more elective surgery coming soon. But those frontline people are still important. How do we, what steps can we do now? I mean, obviously we did some great things in the past, but what, if I could do one thing today, what would you ask, or what would you encourage me to do?
The thing I would encourage you to do right now is, if you're in a situation where you're able to, and we understand a lot of members of the community aren't able to support financially. I think one of the most important things that we're doing is what we've called a hero fund. Our frontline caregivers, and those frontline caregivers, at first people think, well, that's the nurses and the doctors, and that's definitely that group of people. But it's also the environmental services people, it's the techs, it's all of those people when you go into the hospital who surround and support the health, the care that you're receiving. We launched a couple weeks ago what we're calling a hero fund, and that's to provide extra support for those caregivers, because those caregivers are coming to St. Charles. Those caregivers are the ones that are putting themselves at risk and putting their families at risk. they can have all the personal protective equipment and all those things, but it's a lot of it's that psychological factor. And so what we're doing over this next month to 6 weeks is to provide them with a little extra financial support. The health system committed $1 million for that. We're trying to match that within the community, and it's going to go to about 2,500 frontline caregivers. I'm not a frontline caregiver. I work for the health system, but it's those environmental services folks, it's the doctors, the nurses, all of those people. And so I think that's really one of those tangible ways that the community can support those caregivers. One of the things that St. Charles has done, we have a great deli and we have a great cafeteria, and we've been bagging food up. And so when caregivers leave and they don't want to go to the grocery store, there's, periodically been some extra supplies for them. I mean, it's all those little things that St. Charles is trying to do. And so that would probably be the first and foremost thing that a member of the community could do immediately is to support that fund.
Mm-hmm. Yeah, and I just put that up on the screen just briefly. I'll just throw it up here again. It's it's actually on the St. Charles Foundation website, and
Yep.
It is the St. Charles Hero Fund. If you scroll down to the bottom, there's a way to donate, and that is the reality. I mean, these frontline care workers have put their lives on the line for us. And, it is our opportunity to give back in whatever way we can. And I definitely appreciate you guys doing that as a match so that these critical healthcare workers can, obviously get some benefit and say, hey, this was important and we're going to realize that.
And 100% of it goes to those frontline caregivers. The St. Charles Foundation, we're the philanthropic arm of the health system. And we're part of the health system. And so we just want to make sure that everybody knows that there's no, service fee or something else that's coming off of that the foundation is taking. That money is going directly to that pool and those caregivers.
Right. Yeah. And that thank you for clarifying that, because that is a good point for sure. So obviously, monetary this is definitely one of those things we can push everybody to. Have you during this time, have you gotten a chance to talk to some of these frontline care workers, and what have they said to you as far as community and what they have valued from just those simple acts from a community service orientation towards them?
Well, I think one of those tangible things is the challenge of, there was a real fear that we were going to run out, or we could run out of the personal protective equipment. And, when you're going into a battle like this, to not feel like no fault of the health system, but there was a shortage of those things. And so I think the caregivers have really felt that sense of the community coming around and surrounding them. And when you go out and you say, okay, members of the community are gonna make 10,000 masks. I mean, that's an incredible number of masks. And to give you a little bit of perspective, one of the reasons that they canceled a lot of the elective surgeries was because those surgeries are you use a ton of that equipment and those masks and all those things in those surgeries. And so that's one of the main reasons that we had to pull back from that, is to preserve, looking forward, that the protective equipment. And so when caregivers felt that security that they would have that, and the community was coming forward, distilleries making hand sanitizers.
Right.
Again, that was one of the real fears of, am I going to be able to do the simple things like clean my hands or have a mask or a face shield? We've had dentist office who are making 3D face shields. So it's really the ingenuity and the innovation of the community coming forward and saying, how can I help? Other dentists and doctors' offices and vets and other places have donated their personal protective equipment. we had a company out in Madras who donated 2,500 masks. We had the Rotary Club of Redmond who donated 250 masks. I mean, that's just amazing support from the community.
Right.
Um,
Yeah. No, that's it is, and I had heard a rumor that there's even a dental office that had donated all of their, or I think it was on Z21 or the Bulletin ran a story about a dental office that had donated all their equipment, and that now they're like, well,
yeah,
it's
yeah,
okay. We're gonna
yeah,
figure this out because it was
yeah,
important in the time. And
yeah.
I do have a bottle of the Oregon Spirit Distillers hand sanitizer right here. So yeah,
Well, and
it's
then the things you figure out. Okay, what is going to meet hospital standards versus what's just going to make meet other things. And so there's this whole universe of things that we have to think of when somebody tries to make a donation, is doing the right thing, and then you're like, okay, well, is it going to meet the criteria that we have to have at the hospital and the safety things? So that sometimes people have donated things and we've said, well, we can't use that, but another area of the hospital can use it. So it's just,
yeah.
it's,
Can you talk a little bit about so obviously there's the front. I think you brought up something kind of interesting in the fact that we don't necessarily think about all of the behind the scenes, like the workers, the logistical support that goes on. It's the doctors, the nurses, but then there are all these people that my mic just disappeared. That are essentially every day, almost right along with them, and
right.
that must have been a Herculean effort from those people too, I would imagine.
Oh, absolutely. I mean, when you think of a room and you think of patients in a room, um, they go home, they're discharged, and there's a tremendous amount of work that goes into a team going in and in a very quick turnaround, trying to turn that room and completely clean it. And so the environmental services people have just done a Herculean task on that. And then you think of, okay, if I'm gonna have a test done, or I'm gonna have something done, the lab techs or the other techs who do a lot of that work, those are really the heroes that are making the work that the doctors and nurses are doing possible. And so we really felt like it was important to include them in this. But frankly, at a time where I know that you had Sherry Helt on Friday, who did a great job explaining. I mean, the health system has lost close to 50% of its revenue over
Mm-hmm.
the last 2 months.
Right.
Now we're starting on May 1st, going to be able to begin to bring in some of those elective surgeries that are so important to so many people. But that's a source of revenue for our health system as well as every other health system. And then you flip that around and you say, okay, just for logistically trying to figure out how to do emergency departments that are out in tents, or we had a surge plan to double our capacity. We have 274 beds within the St. Charles Health System. How do you double that capacity in case there is a surge? We couldn't go based on the fact of, this is kind of the best case scenario where there's, 50 people or 47 people within the health system yesterday who had been diagnosed with it and 2 in the hospital.
Mm-hmm.
But in, 8 weeks ago, we were wondering, are we going to get hit with a capacity that's way bigger than we can handle? And so
Right.
we had to be prepared for that.
Mm-hmm. Yeah, and so yeah, I guess actually you did bring up an interesting point, and since I have you, what are St. Charles? I know Sherry's going to probably tell me on later today. But what are St. Charles' current numbers at this point in time?
So I haven't seen for today. As of yesterday, we had 2 patients in the hospital who are hospitalized with it, and 47 that were within the system. So that had gone through our lab. And then we'd had over 1,579, I think it is,
Mm.
negative results, and 56 that were pending. And so while we have a lot of people, or some people in the community who have it, a lot of those we're being able to treat those, or they're being treated in an outpatient environment, so that there's only a couple right now that are in the hospital, but that's largely because of the social distancing that we've done.
Right. Yeah. So the one of the other things that you guys as a foundation have historically done is an amazing event called Heaven Can Wait. And is that what I don't remember even what the date usually is? Is that are you still planning that event? What is that? How does that look right now?
So typically, Heaven Can Wait is the first Sunday in June, and we have about 2,000 runners that all come together at Drake Park, and we support some Sarah's Project, which is a cancer fund that does Reiki and massage and all of these different um, patient support services for cancer patients throughout Central Oregon. And people have been very generous. That race has been going on for 20 years. People absolutely love it. But we saw that, we're probably not going to do too much good in the community if we try and bring 2,000 people together on June 1st, June 5th, or whatever the first Sunday is. And
Right.
so what we've decided to do is have that be a virtual run race. People from June 7th through the 14th can do a 3 or a 5K within their community. It's $25 to participate, and we will send people a bib number, and we're asking people to take pictures of themselves, kind of emerging out and doing Heaven Can Wait throughout Central Oregon.
Mm-hmm.
This year, it's going to go to the Hero Fund. This is the only year where we'll pivot it. We got approval from the organizer, or the cancer center, who said absolutely we want to do that, because some of the people in the cancer center are considered frontline caregivers,
Mm-hmm.
and so it's going to support them, because people still need to be getting their cancer treatment at the cancer center through this period of time. And so that's going to support the Hero Fund. And then if people want to buy a t-shirt, I think those are $20. And they can register at heavencanwait.org if they're interested.
Yeah, which I think that's a really great opportunity. I know that event has been around for a while, and so just the ability for you guys to, like you were saying, pivot and be able to support in a different way, I think that's a really neat thing. Is there anything else that you wanted to share with us as far as ways that we, as the general population, can help support these critical frontline all workers, whether they be the operations people or the docs or the nurses, here going forward and for the next few months until we sort of have a new normal, I guess, is what it's going to end up being.
Well, I think the St. Charles was founded about 100 years ago when a few sisters came out from Indiana, and the premise of that was to care for all or to care for none. That's really where St. Charles, the roots of St. Charles, and we're a community owned asset that the community has really always partnered with us, and we just want to say how much we appreciate the ongoing support. We're here to serve the community, and the community has always been a great partner with us. And we're all in this together, and we just appreciate what the community's doing, and hopefully will continue to do in an environment that's tough for everybody.
Mm-hmm. Yeah. John, thank you so much for taking the time today. I really do appreciate you letting us know how we can help support those critical frontline workers right now.
Thank you. Thanks for the time and the opportunity.
Absolutely. Yeah. So as I mentioned, that's John from the Foundation, St. Charles Foundation, John Jepson, and he is. So if you need more information, go check out the Foundation's webpage. Both of those links were there. So there's the St. Charles Hero Fund, and then also the Heaven Can Wait, the virtual 5K is going to also be there. So I appreciate you all joining me for another edition of Show Up Central Oregon, and I will be back at let's see, 3 o'clock for Tom Schnell of Business Oregon, talking about what we can do as small business owners, and then I'll also be talking to Sherry Helt at 3:30, and she's going to be giving us some numbers, what's going on with PPP, and all the other things for the state of Oregon. So thanks again for joining me, and again, show up for Central Oregon.